Welcome to the Pharmacy Laws Podcast. Today, we're going to be taking a deep dive
Deep dive.
into USP 795,
I love it.
the gold standard for non-sterile compounding.
Yes.
So you know all those custom medications that your doctor might prescribe?
Right.
Tablets, liquids, creams, ointments, even nasal sprays.
Oh, yeah.
We are going to explore how pharmacies
Okay.
make sure that those preparations are safe
Right.
and effective
Love it.
every step of the way.
So what's so fascinating about USP 795 is that it actually lays out the minimum requirements
Oh, amazing.
for compounding these non-sterile preparations.
Okay.
You'll hear them called CNSPs.
Got it.
And it doesn't just apply to pharmacists.
Really?
We're talking nurses, physicians, vets, even dentists and chiropractors
Wow.
who might compound medications as part of their practice.
So it's not just about what happens inside of a pharmacy.
No, exactly. USP 795 applies to any setting where these medications are made,
Interesting.
from hospitals to private practices. And here's where it gets interesting for those that are prepping for exams or even an audit.
Okay.
The chapter dives deep into personnel qualifications, facility standards, equipment, even the specific components that go into those preparations.
Let's talk about the components for a sec.
Okay.
What kind of things does USP 795 have to say about the ingredients themselves?
It's pretty strict. It's kind of like, think about baking a cake.
Okay.
You wouldn't want to use spoiled milk, right?
Right.
USP 795 emphasizes the importance of sourcing high-quality ingredients,
Mm-hmm.
inspecting them carefully, and storing them properly to maintain their integrity.
Makes sense.
And you need to document every step.
Right.
Numbers, expiration dates, the whole 9 yards.
Wow.
That way, if there's ever a problem, you can trace it back to the source.
Documentation, that's a recurring theme in pharmacy, isn't it?
Always.
What are some of the essential documents we need to be familiar with
Okay.
for USP 795 compliance?
Two big ones you'll see are your master formulation records, or MFRs, and your compounding records, or CRs.
Okay.
The MFR is like your recipe. It details exactly how a CNSP should be compounded, including the specific equipment and techniques.
All right.
And then the CR documents what actually happened during compounding for each batch.
Oh, okay.
Like a detailed blog book.
So if an inspector walks in, they're going to want to see those records, right?
Absolutely. They'll also want to see proof that everyone involved in compounding is properly trained.
Oh, wow.
And not just on the technical aspects. Think hand hygiene, garbing, cleaning, and sanitizing procedures.
Wait, hold on. I'm picturing like a 30-second hand washing routine, like we learned back in school.
Yeah.
Is that what USP 795 is talking about?
That's the foundation, yes, but the chapter goes a bit deeper.
Yeah.
It specifies the type of soap,
Really?
the water temperature, even how to dry your hands
Wow.
to minimize recontamination.
Okay.
And don't forget about the garbing gowns, gloves, hairnets.
Oh, yeah.
All designed to prevent contamination from the compounder to the preparation.
It's like a fashion show for pharmacy safety.
Yeah.
But in all seriousness, I can see how these seemingly small details could make a really big difference in preventing contamination.
Big time.
Speaking of which, what about the compounding environment itself?
Okay.
What kind of facility requirements do we need to be aware of?
Cleanliness is paramount.
Okay.
We're talking designated areas for compounding, appropriate ventilation, and strict cleaning schedules for all surfaces and equipment.
Got it.
And speaking of equipment, USP 795 gets very specific about the types of equipment allowed, from balances and graduated cylinders to more specialized systems like containment ventilated enclosures.
Containment ventilated enclosures.
Or CVEs.
CVEs, those sound pretty high tech.
They are.
What's their role in non-sterile compounding?
They're critical for protecting both the compounder and the preparation when working with hazardous materials.
Okay.
Think about things like hormones or certain chemotherapy drugs.
Wow.
A CVE helps to contain any airborne particles, preventing them from being inhaled or contaminating the compounding area.
So it's kind of like a safety bubble.
Exactly.
Around the compounding process.
It's an added layer of protection that's become increasingly important in modern compounding practice.
That makes sense. So we've covered personnel, facilities, equipment, even the ingredients themselves.
Yeah.
But what about the final product?
Okay.
I imagine there are rules about how long compounded medications can be stored before they expire.
Right? You're thinking about beyond use dates?
Yes.
Or BUDs?
Right. I was about to ask, is this like that jar of mayonnaise in my fridge where I just cross my fingers and hope for the best?
Not exactly. We'll decode the difference between a BUD and an expiration date, and how USP 795 helps you determine those critical timelines.
This is getting good.
Right.
Stay with us while we take a deeper dive into BUDs right after this.
Ooh, I love it. You're right to point that out. BUDs aren't a guessing game like that mayonnaise in your fridge. A BUD and an expiration date. Those are two different things. You know, that expiration date printed on commercially manufactured products, that's set by the manufacturer and tells you how long the product is expected to remain stable, assuming it's stored correctly.
Makes sense. So how do BUDs work then for compounded medications? Those aren't coming straight from a manufacturer with a predetermined date.
That's where USP 795 provides those crucial guidelines for establishing BUDs.
Got it.
Several factors come into play.
Like what?
First, consider the type of preparation. Is it a liquid, like an oral solution, or a solid, like a capsule? Those have different inherent stability characteristics. Then think about the storage conditions. Temperature and humidity play a big role in how long a preparation remains stable.
So even if I compound something perfectly, if I don't store it correctly, I could be shortening its lifespan.
Exactly. And here's where it gets even more interesting. USP 795 also requires us to consider any available stability data for the specific ingredients and the final formulation.
So I can't just assume a BUD based on the general type of preparation. I need to dig deeper into the specific ingredients and how they interact with each other.
You got it. It's about taking a multifaceted approach to ensure we're assigning a BUD that truly reflects the stability of that particular compounded medication. And remember those expiration dates on the components we talked about earlier? Those are critical too.
So if one ingredient in my formulation expires in a month, even if everything else is good for longer, that shorter expiration date will likely limit my overall BUD.
Precisely. It's like a chain. The weakest link determines the overall strength.
Got it. And let's not forget about preservatives.
Yes.
They play a huge role in BUD determination.
Big time.
Especially for preparations that contain water. Preservatives, so we're talking about those ingredients that help prevent microbial growth, right? Do they always extend the BUD?
They can, but it's not a guarantee. USP 795 outlines specific requirements for testing the effectiveness of preservatives to make sure they're actually doing their job. You can't just assume they're working. You need data to back it up.
So it's not just about adding a preservative and calling it a day. You have to prove that it's actually effective in that specific formulation.
Exactly. And even with preservatives, storage conditions are still paramount. Think about that open bottle of oral solution in your refrigerator. USP 795 often recommends a much shorter BUD. Once that bottle is opened, even with preservatives, because of the increased risk of contamination.
That makes sense. It's like once you break that seal, the clock starts ticking a little faster.
Exactly.
It's fascinating how much goes into determining these BUDs.
I know, right?
It's definitely not as simple as just slapping a date on a label.
No, not at all. It's a meticulous process that requires a deep understanding of the ingredients, the formulation, and the potential risks involved.
So we've covered the who, what, the why, even the when of USP 795.
We have.
But let's shift gears now and talk about the how. Specifically, how to ensure your pharmacy is audit ready.
Oh, yeah.
Those inspections can be nerve-wracking.
They can be.
So let's break down exactly what those auditors are looking for. And how to be prepared without losing sleep.
It's like studying for a big exam. You want to make sure you've covered all your bases. And one thing that always impresses inspectors is a well-organized and easily accessible SOP manual.
SOP manual. So we're talking about those standard operating procedures that outline every process in the pharmacy.
Exactly. Think of it as your compounding Bible. It should clearly outline every procedure, from hand hygiene and garbing to cleaning protocols.
Equipment maintenance, documentation practices, the whole 9 yards.
So it's not just about having SOPs. It's about having them compiled in a way that's user-friendly and comprehensive. That makes sense. What else can we do to prepare for an audit?
Regular internal audits are invaluable. Don't wait for an external inspector to point out areas for improvement. Think of it like taking a practice exam. It helps you identify any weak spots before the real deal.
Internal audits, that's a great idea. But where do we even start?
Okay.
Should we be using the full USP 795 guidelines as our checklist?
Absolutely. Use the chapter as your guide.
Okay.
And don't be afraid to get specific.
Right.
Walk through the compounding process step by step, checking for compliance at every stage.
Check.
Are your personnel following proper hand hygiene techniques?
Right.
Are your facilities clean and organized?
Got it.
Are your records accurate and complete?
It's almost like role-playing an inspection.
Precisely. The more you practice, the more confident and prepared you'll be when the real inspector arrives.
That's a great tip.
Yeah.
Any other advice for our listeners as they prepare for a potential audit?
One more thing, continuing education is crucial.
Oh,
USP 795 isn't static. It evolves over time.
So we need to stay up to date.
Yes.
On the latest revisions and best practices.
Exactly. There are tons of resources available.
Okay.
Webinars, conferences, online courses that can help you stay informed.
It sounds like preparation is key.
It is.
A well-structured SOP manual, regular internal audits.
Yes.
And a commitment to ongoing learning.
Yes.
Can go a long way in ensuring a smooth and successful inspection.
You got it.
Right.
Remember, compliance with USP 795 isn't just about checking boxes.
Right.
It's about protecting patients and ensuring they receive the highest quality compounded medications.
This deep dive into USP 795 has been incredibly insightful.
It has.
We've explored the key elements of compliance.
Yes.
Decoded those all-important BUDs.
Yes.
Uncovered some expert tips for acing that inspection.
Right.
But before we wrap up,
I
have a final thought-provoking question
Right.
for our listeners to ponder. We talk a lot about the technical side of things, the procedures, the documentation, the equipment. But what about the human factor?
Okay.
How can compounding pharmacies foster a culture of quality and safety that goes beyond just following the rules?
That's an excellent question, and it gets to the heart of what makes a compounding pharmacy truly successful.
Okay.
It's about creating an environment where everyone understands the importance of their role in patient safety.
Okay.
It's about empowering staff to speak up if they see something that's not quite right.
So it's not just about top-down directives. It's about building a team where everyone feels responsible for quality.
Precisely. And that starts with leadership setting the tone.
Okay.
When pharmacists and managers prioritize safety and emphasize continuous improvement, that mindset trickles down to the entire team.
That makes sense.
Yeah.
If the people in charge are constantly looking for ways to do things better, it sets an example for everyone else.
Exactly.
Are there any specific things that pharmacies can do to cultivate this culture of quality?
Absolutely. Regular communication is key.
Okay.
Hold team meetings where you discuss recent updates to USP 795, share best practices, brainstorm ways to improve workflows, and don't underestimate the power of positive reinforcement. Recognize and reward staff members who consistently demonstrate a commitment to quality.
So it's about creating a feedback loop.
Yes.
Where everyone feels heard and valued.
Exactly.
And it's about celebrating those who go above and beyond. To uphold those high standards.
It's about fostering a sense of shared responsibility and pride in the work being done.
This deep dive into USP 795 has been incredibly insightful.
It has.
We've explored the key elements of compliance.
Yes.
Decoded those all-important BUDs. Uncovered some expert tips for acing inspections. And even touched on the importance of creating a culture of quality within the pharmacy.
And we've only just scratched the surface.
Right.
USP 795 is a rich and complex topic with a lot of nuances to explore.
That's right. But remember, this deep dive was all about giving you the essential knowledge and tools to navigate the world of non-sterile compounding with confidence.
Absolutely.
So as you continue your journey into USP 795, keep those questions coming and never stop striving for excellence in every aspect of your compounding practice.
And always remember, at the heart of it all is the patient.
Right.
By adhering to the guidelines set forth in USP 795, you're not just meeting regulatory requirements.
Right.
You're playing a vital role in ensuring the safety and well-being of every individual who relies on those compounded medications.
That's a powerful reminder. Thanks for joining us for this deep dive into USP 795.
My pleasure.
We'll be back next time with another fascinating exploration into the world of pharmacy law.
I can't wait.
Until then, stay curious, stay informed, and keep those compounding skills sharp.